morning, good afternoon, good evening to all of you joining us for this important session. And this is the Pulse on Family Planning with Dr. T. Now, some housekeeping before we get on with the conversation. If you would like some French translation, please click on the language icon on the toolbar of your Zoom and choose the translation option. And of course, we encourage you to interact and respond and have questions to the panelists. And to do so, please use the Q&A section and place your comments or your questions in that section and not in the chat. My name is Dr. Tlaleng Mofokeng, and I'm not alone. I am with Vithika, Yadav, I'm with Kerigo, Odada, and I'm also with Margaret, Bolaji-Adegbola. And on this important day of World Contraception Day, we've decided to bring you this panelists for a virtual discussion, a virtual check-in of sorts on how all of us are doing in our respective areas of work around family planning and contraception. And of course, this day provides us an opportunity to talk about what universal access to contraception and family planning services mean. We are having, of course, this virtual consultation and virtual session amidst the COVID-19 pandemic that continues to be an evolving health emergency around the world. And so this conversation will help tie the conversation of the broader International Conference on Family Planning 2022's theme of universal health coverage and family planning. And of course, I need assistance. I can't have this conversation on my own. And to help me take the pulse on family planning is, of course, Margaret, Kerigo, and Vithika. And I'm going to start with you, Margaret. A very simple question, but I think a very important one at this time. How are you doing at this moment?
Hi, Dr. T, and hello, everybody. I'm doing amazingly well. It's been quite hectic, so many work to do. But again, this is what that makes me happy. I'm really passionate about the work that I do. So working in Nigeria as the founder and executive director of Stand With a Girl initiative, we have a couple of projects, but right now I'm most passionate about data made simple. And you know, in the Nigerian way, in Pidgin, we say data we know hard. And really, we're simplifying data to ensure we can be used for decision making. And that's what I've been up to lately. But yes, I've been really good. Family is fine, work is good. And yes, thanks for checking on me, Dr. T.
Thank you so much, Margaret. And I'm happy to hear that you are doing well, despite the challenges of this time. And coming to you, Kerigo, how are you doing?
Hello, Dr. T and my fellow panelists. Thank you very much for today. Personally, I don't know how I am feeling, but so far, so good. I'm grateful for being able to come this far despite the pandemic, creating a huge barrier in terms of very many activities that we are doing. But from the Youth Coalition, I would just like to say that it's been a long learning experience where we've been forced to adapt, change, but also a chance to just look internally and also think about ourselves. So I'm happy that despite the pandemic, we were able to overcome, and we are still trying to overcome, and also factor in issues around our mental health that we think is quite important to our work. But so far, we hope everything just goes on well going forward. Thank you.
Thank you so much, Kerigo. And I can identify with many of the challenges that you speak of. Coming to you now, Vithika, how are you doing, sis?
Good evening from India. Well, I'm delighted to join this conversation, the pulse of family planning, with the most amazing Dr. T and the most amazing advocates here. Well, talking about how I'm doing, you know, I would say it would be the understatement of understatements while talking about, you know, what we have been going through for the past almost 2 years now. And this year for me has been a year like nothing that I've experienced in my life before. It's been one which has been full of personal pain because I lost my father. Work-wise, I mean, just in terms of what we see around us, lives have been lost, lives have been turned upside down, lives have changed forever. And I guess I find myself discovering a new word like everyone else, new normal, both in my personal life and otherwise. So I think I'm in that phase where I think I'm examining my life and reassessing just what is important, what is not important, and I guess I'm doing that professionally as well, because COVID-19 has had significant impact on sexual and reproductive health and rights of young people as well.
Sure. Thank you, Vithika, for sharing that, and of course, condolences on the loss of your dad. And I know many people who are watching this may very well still be dealing with grief and all sorts of emotions, and at the same time being champions, being youth activists, being advocates, and having to show up, right, for the people who we do this work, as the beneficiaries. And I think for me it was important to start with that conversation and that question first, because we too are the beneficiaries of this work. We too are young women who need all of these wonderful opportunities and access to services and our rights promoted and protected. And so thank you for that. And I think the fact that you did choose this time and take the moment, and this goes to all of my panelists amidst very challenging schedules, to be here is really, really appreciated. And I want to start, of course, and taking the advantage that we do have some regional representation. How have you, Margaret, seen in the region where you work, in the country where you work, have you seen the direct impact of COVID-19 on adolescent and youth sexual and reproductive health services?
Thank you, Dr. T. And of course, just like my other colleagues, the co-panelists have spoken about COVID. COVID has been just a different ball game. We weren't expecting it, but then it came, but we had to overcome it. And it's not just I alone who is going through the so many challenges that COVID came along with. And it's also interesting to note that it also came with some advantages, which I hope to mention subsequently. However, it's good to start with those disadvantages that I've seen it come with. And for me, it was even me, it started with me. So I just had a baby, and 4 months into that, I was just planning to get back to work. And that was when, in fact, I had applied to say, I need 3 more days. You just never get ready enough to just tidy up things. And before the response from my supervisor came, it was, oh, we have to stay at home, so work from home. And to me, it was like a joke, like, oh, okay, maybe more time to stay with my baby. But then before I knew it, anxiety, and then we kept hearing about the news was also popping out, the number of deaths, the number of people infected with COVID. And it was just a roller coaster emotions that kept on coming. And I know that I also wanted at that point, because it was just 4 months, and then I was considering a family planning method. And because I was working as an advocate and also a programmer in that field, I had to speak to a family planning coordinator. So I felt I had that connection. And I just spoke to her that I would need, I know all of the methods. So I just told her I want IUD. And then the next thing she asked me were, of course, some questions, trying to do some virtual. We should have met in person, but of course, because of COVID, I had to put a call through. And she said, oh, maybe you should consider another method. And the reason is because we need to clean up a lot of equipment. And right now, the other nurses who should have helped with this are not in the facility, and a whole lot of that. And it was at that point that it dawned on me that while we were all focusing about COVID, it wasn't just COVID. Oh, adolescent and youth. So what exactly are they doing about their sexual and reproductive health? And then I started reaching out to friends and saying, what's happening? So there were commodities stock out on contraceptive, there were increased costs, lack of access to facilities, of course, because of the government movement restrictions. There were also a lot of myths and misconceptions flying around, because people were, in fact, I love to quote some that I found from while I was discussing with with my colleagues. And okay, so someone said we have been relying on withdrawal method, and in fact, it said AKA is also known as pull-out. The pull-out game has to be strong since we can't access contraceptive. This was one of the young people that we were working with. Another that was so disheartening, it said due to the shortage of condoms, we now use salt to prevent pregnancy, and it's been working. I like, salt, what exactly do you mean? Again, these are a lot of myths and misconception and some other methods that young people were having to resort to. And then another also said, young people around me use overdose of anti-malaria to prevent pregnancy. All of this didn't make so much sense to me. And then another young people said, some of my buddies, like my friends around, have been coming for condoms, and I can't help it but get some for them from facility that I am familiar with. Again, it talks about how important PPMVs are. And so it was really, it just dawned on me that there was so much that young people were passing through, of course, as well as adults, in being able to access healthcare. But just like I said earlier, beyond this, it was now an opportunity for young people to come together and say, oh, we can leverage on the power of social media to be able to dispel all of this myths and misconception. We also need to strengthen referral. We also need to be speaking to the government. And it was just a whole lot of issues happening at that time. And for me, the take home at that point was the fact that, oh, COVID is here. There's a lot of attention on COVID, but it's also important that we do not lose the gains that we have with regards to sexual and reproductive health and rights. But one interesting thing that I have to mention is also the fact that while the presidential task force were rolling out messages and services at the subnational level, which is the state level, there were advocates who kept on saying, hey, we must advocate for integrated services. And that's just to really reiterate the fact that that's the way to go. So it's not just family planning alone. Every other service has to come together for young people to have access to sexual and reproductive health and all of that. So it was really a whole lot, and there's so more to share, but of course I will just take a pause at this point and then come in later. Thank you for asking the question, Dr. T.
I think this has been really useful information, and it makes me reflect on some of the experiences we have heard from young people in India and how COVID-19 and also, the measures to curb it. For example, the lockdown has had a huge impact on all aspects of young people's lives. In India, I mean, of course, with school and, colleges closing, perhaps the only opportunity we were chasing to have girls stay in school, to be able to avoid early marriages, to be able to provide education, that opportunity was taken away, and it has done so much harm. It has worsened existing inequalities. There have been lots of cases where we're seeing early marriages and forced marriages. Families have lost income, and every time we're reaching out to young people and their families in the communities, of course, this question is out there for all of us to answer. What about financial situations in the families? Incomes have been severely affected. And, with that, the fact that mental health issues in terms of what young people have been reporting and talking about, socializing and being out with their peers is a huge part of their lives. And that was taken away with COVID-19 and lockdown, which was an important step perhaps, but it has really worsened the situation. They find themselves struggling and dealing with lots of mental health issues. Some of them cannot even articulate it as mental health issues. It is very, very difficult to provide services. There is very little understanding of even acknowledging mental health issues as a problem that needs to be addressed. There is a dearth of counselors. And I think, of course, since they were, bound to their homes, and especially when we're talking about confidentiality and young people having a life outside and accessing contraceptives, that has been severely affected. There have been times where young people did not have even access to sanitary napkins, let alone other contraceptives. So the situation has been really, really bad. And I think in terms of just access to family planning services, that was severely disrupted, both from production to the supply chains to how they would have perhaps accessed it. I just wanted to add that point.
Yeah, thanks, Vithika. I mean, you're speaking about disruptions in production. And I don't know if anyone knows that the African continent still imports condoms, right? And we know how important condoms are in terms of providing, protection from sexually transmitted infections as well as pregnancy. And when lockdown happened, and international cargo and freight was impacted, one of the very first problems we saw was a lack of accessible both internal and external condoms in public spaces. And something that Margaret spoke about earlier, it's the fact that many services around adolescent and youth sexual reproductive health have impacted, and the impact was not foreseen or proactively planned for, right? And then resourced. It's almost that COVID happened and the resourcing in terms of money and staff went to COVID. So even where there were commodities, even where clinics were still operating, healthcare workers were then shifted from those family planning units into more COVID-specific responses. And of course, we understand and we know why that was important. But I think this speaks to a bigger call of why all of us are still demanding for an integration of services, especially around contraception and family planning. And Kerigo, I know you have a very important experience around COVID and lockdown and having to go from different spaces. And that often means your ability to access services is also impacted, right? Would you like to share with us how COVID-19 for you has impacted your work around family planning, if at all?
Thank you for mentioning the issue around universal access to contraceptives. And coming from the Youth Coalition, which is an international youth-led organization, we were able to have a bird's eye view of what the situation is, primarily because we are in touch with very many youth-led networks on the ground. And for us, what was alarming for us was that we are talking about universal access to contraception, which basically means everyone should be able to access contraception wherever they are, whenever they need it. And what COVID-19 showed us is that we are very, very far from realizing that, because states are not investing enough resources required to realize that particular vision. And for young people, when that is the status quo in very many parts of the world, it means that when things like stockouts happen, young people are the ones who are hardest hit because the costs go up. And when the costs go up, out-of-pocket expenditure, of course, young people cannot afford. So we were just seeing that if we do not pay attention to the policies and the legislations that govern access to contraception, starting from the international level, we're going to experience very many challenges trickling down, because universal access to contraception, quite honestly, from what we have seen, is not about lack of access to funding or resources. It's about political will and whether or not we have governments and institutions willing to actually put their money where their mouth is. Because when we were raising alarm over the fact that we are facing a silent pandemic, they decided to listen and take up measures to ensure that we do not have this pandemic, this other silent pandemic manifesting. So the question is, what happens on this other during these other occasions when we don't have a pandemic? It is just about lack of political will. And this lack of political will to invest in universal access to contraception is influenced by very many factors. And one of those things is issues around religion and culture. Currently, there's an onslaught against access to contraception and availing family planning services to not only young people, but also adolescent girls. But we are saying we cannot play politics with the lives of young people. So as the Youth Coalition, sitting in a position where we are able to engage with very many young people from from diverse backgrounds, we are listening and hearing the same concerns being raised. And it so happened that 2020, we were marking Beijing plus 25. So that also gave us another dimension where we were interacting with not only young people within our networks, but young people and other feminist organizations within the Beijing plus 25 framework. And the issues are still the same. So yes, COVID is here. And to be honest, I don't see COVID ending anytime soon. However, we cannot continue with this approach where we don't integrate issues around family planning into the overall goal of universal health coverage. Thank you.
Yeah. Thanks, Kira. And you said something about policies, and it reminded me about how vigilant we actually have to be at this time, because we've seen in different parts of the world how the COVID emergency policies that were created, and sometimes limiting, right, liberties, social liberties, political participation, civil, and the like, and how some of those so-called COVID-related measures in terms of policy and limitations of rights have a risk of actually becoming long-term policies even outside of an emergency. And I know a particular group of young people who had written to me to say, in our district, the government or the health department has listed a whole lot of services that they deem as essential. Meaning, if you get stopped on the side of the road and you explain that you're going to the clinic because you are asthmatic and you need oxygen, then the police or whoever's enforcing the curfew will let you through. But what was happening is that because sexual and reproductive health services, including family planning services, were not listed as essential, young people were then not only having to navigate the usual difficulties, right, of stigma and delays in accessing care, but they then had the other issue of having to deal with the militarized response to the pandemic and then the military enforcing curfews. And they then had to out themselves to say, well, I may be a young person, I know I should be at home, but I need my family planning, services. And so there was that bit of a tension and a bit of a anxiety as well that young people had to say they now feel that privacy and that confidentiality is no longer there. And we know how important as key principles those two are. And Vithika, did you see any of this in India with the kind of curfews that you had, or was this not quite a prominent complaint?
This was, Dr. T, quite a prominent complaint. And I mean, when we talk about complaint, I think, young people were not even finding enough spaces to voice their opinions. We could see that in the rising number of, sort of cases when we talk about unsafe abortions. We could see talking about getting information on how young people were struggling with mental health issues, a number of suicides. So a lot of that, sort of was being shared. So with everything, with the curfew, the lockdown, a lot of things changed in their lives. Access to even information, because a lot of them were going through financial issues within families. They did not even have enough money to recharge their phones with enough data to be able to access information, then be able to access any kind of services. I mean, also the fact that, the fact that this was not listed as an essential service was, left everybody confused. I think what the conversation that I had with some of the production companies was also that they were also struggling because it wasn't listed as an essential service. They also didn't know, how to get the supplies running. I think, perhaps the response, the way it came, nobody would have anticipated this is how COVID would have hit. But it also, in case of India, with the first wave and the second wave, what we definitely saw that was how weak is a primary healthcare system. We have never focused on it. We have frontline workers, we have the ASHA workers, we have a whole military, so to say, when we talk about frontline healthcare workers. And we know that there are so many gaps when we talk about how primary healthcare system in India works. We focus on treating, but we never focus on what can be changed at the primary, in the healthcare system. We have never talked about how to make the youth clinics, even in the most remote areas, which are actually a part of the system, right? Which are being given by the system. But do you actually have well-trained, youth-friendly doctors there? Are they providing the information? Are they giving options of, teleconsultation to young people? Even when we talk about teleconsultation, do young people have mobile devices and internet connectivity, which I know is, sort of, it's not such a big issue, anymore. But we also, in context of India, we can't say that this is not an issue, because there are marginalized communities, there are lots of young people in hard to reach areas, and it's been extremely difficult for us also as information providers to be able to reach out to them during COVID. All our services in the community, the work that we do with peer educators networks and young people was disrupted. We had a very difficult time supplying sanitary napkins and basic, supplies, food supplies in the communities where we work, and especially focusing on young people. So lockdown, curfew, I would say, unfortunately, in a country like India, it's not something that everybody in India can afford. There are lots of people who are dependent on daily wages, who have to go out and work. So it's just something that, works for a certain for a certain class, so to say, but not for everyone. And it's always the most marginalized who are the most affected.
And thanks for that, Vithika. And when you were talking about the challenges that you were having about peer educators and the work you have done in community, I was immediately reminded of the work that Margaret does, right? And much of it depends on meeting people face to face. And I can imagine the challenges that this time has brought, on the landscape of contraception and family planning services. But like you're saying, information and access to information is a huge element of actually increasing uptake in services, because if you don't know something exists in the first place, if you don't know that you have rights to make autonomous decisions about your healthcare, you will never go and seek contraception, for example. So the element of education is important. And Margaret, I'm wondering, from the work you've done in the past year, have any trends emerged in terms of the data that you've been collecting, and how has perhaps the data even influenced your strategies right now on how to reach young people? Because many of us, I know all of us on this call are living in rural peri-urban centers, and most of our work requires us to be mobile and moving from different districts and different areas of the different countries. So how has that impacted your work, and how are you then strategizing forward to make sure that young people still have credible scientific evidence-based information?
So really, I'll just go quickly to talk about the data. So of course, even before COVID, with the NDHS, which is the Nigerian Demographic Health Survey, and that was last done in 2018, we saw that the proportion of unmarried young women that have been, who are currently sexually active, were 25.9%. Unfortunately, we only have 16.2% contraceptive demand among unmarried adolescents between 15 to 19. And with this trend, which is basically some of our advocacy tools to let decision makers know how very important it is to provide contraceptive information and services to young people. But given the pandemic, we saw that even though people have knowledge, the most knowledge that is even prevalent are majorly myths and misconception. So we told ourselves that as much as we couldn't reach people physically, which was painful, especially for someone like me, who just want to jump on issues as they come, because it's always sound unacceptable that there are services, and like Vithika actually mentioned, when stock out happens, it's not just even the cost. Yes, we know the economic burden, but it's also the fact that the service providers feels that, oh, if we just have 2 IUDs left, then an older person can get it. You're just a young person, you can as well do with condoms, if at all. It's in fact, that's for those who understand that you're expected to give balanced counseling, and they can choose from the wide range of contraceptive method. So it was that crazy. So the strategy we adopted then was to really flood the social media. Again, we agreed to the fact that not every young person, especially when you work in rural communities, not every young person have access to internet, not even mobile phones, but a good number. So we needed to start from those who already have access. And basically what we were then using were frequently asked questions about contraceptive. And then we had been working with a lot of youth groups. We have life planning ambassadors, youth advocates who were willing to disseminate in their different fora, especially leveraging on WhatsApp platforms. So they would pose those questions and then get reaction, also using different social media platforms, not just the WhatsApp, to really dispel the myths and misconception. And in the past, we had worked with social media influencers and bloggers. And so it was an opportunity to reach out to them virtually and say, we need to do more. We need to make sure people have access to the information. But yes, we were creating so much demand that the supply gap, the gap in supply was there. But the one thing we then needed to do, we have a list of healthcare facilities that we could refer people. So for those who were bold enough to say, oh, maybe due to proximity, it's not so far. And so long as I put on my face mask, I wash and my hands regularly, I can make sure that distance is there, social distancing, I can at least go to those facilities. But again, we saw the power of the PPMVs, the drug shops, the pharmacies, and we needed to create that linkages and young people have access in this place. But honestly, the gap was so large because people could not access services. Another strategy that really worked was, and I know this was globally, but particularly in Nigeria, gender-based violence, it was like you sleep and then the next morning you wake up, you hear on the news that a girl has just been raped in religious homes. It was just really crazy. And that also made a lot of social media campaign on, because Nigeria have the VAP Act, it's a Violence Against Persons Prohibition Act that has been enacted, but just at the national level, it's not been domesticated and implemented at the state level. So a lot of advocates were calling on their governors, on their decision makers, holding them accountable to be able to domesticate and implement the VAP Act. And that actually made it easier for representatives who were SRHR champions at the Presidential Task Force to say sexual and reproductive health and rights, which included family planning, had to be included amongst essential services during COVID. So the gateway, the entry point for us was gender-based violence, which was staring everyone in the face. But of course, it was all the package. Again, that takes us back to integration. So it was having all of the package put together. But I would say one strategy that works almost perfectly, aside from the fact that we know not everyone have access to internet, was really getting out correct, adequate, and appropriate information to young people via social media. And of course, it was young people naturally became more creative in different formats, video, TikTok. You just need to check it out and see how very innovative young people became during COVID, just to be able to dispel different myths and misconceptions on family planning.
Thanks for that, Margaret. And I think there is no doubt that universal access needs a strong primary healthcare services and infrastructure, and that you shouldn't, or at least access shouldn't be determined by your geographical location, or socioeconomic status. These are very basic healthcare needs that we are discussing today. And even more so, I think you've brought a very important intersection into this discussion around violence and what that means. And I actually found a lot of young people who were emailing me, finding me on Twitter with exactly the same issue. They've experienced violence and they may not know where to go, and there may not be facilities where they live, but many of them knew that they needed access to emergency contraception. And it's such a feeling of helplessness when you can't actually say for sure, go to this primary healthcare facility near you and you will get assistance. And I think that's a feeling that, you know, sometimes I think can make us feel a little helpless. And then again, I suppose we then come, you know, together for these important discussions to kind of get energized again, you know, and see that these issues don't only just affect us in a particular area of the world, but these are universal problems. And that's why I think we need to be working closely together across regions in terms of policy frameworks that support the implementation of this work. But more importantly, we need to start demanding budgets and allocations and spending on contraception and family planning as their own line item that's very clear, because it's very easy, like Margaret is saying, people to then just start having hierarchies in terms of who can access care. You know, you're an older woman or an adolescent girl, the older woman gets the IUD, you know. And so I think, yeah, it's important to do this work with that in mind, that it has such potential as a healthcare issue of access, but it has the potential to affirm and to protect people's human rights, right, to autonomy and to body integrity. And Kerigo, coming to you, I just want to find out, how have you seen the coverage, I suppose, in terms of information to young people consistent over this time, or do you see any gaps, or are you seeing that many young people around the world are able to access the information they want? And I'm particularly thinking about, you know, a case in Uganda, for example, where a health app was developed, you know, in response to issues of accessing literal contraception and family planning methods. Have you seen any new ideas, innovation around information and communication in your area?
Yes, thank you for that question. And for me, the first thing that comes to my mind is young people are very innovative. Young people are able to adapt, and they're able to adapt in ways that they feel works for them, right? And in very many conversations that we have with them, they say, we're like, the older generation needs to understand they have to be able to include us in conversations and understand that we organize different and we do our things differently. And because of that, we have been seeing a lot of apps being developed, apps around making sure people have, like Margaret has said, access to information, apps that they combine access to information and service delivery, where people are able to map, see where they can get services, because within these apps, youth-friendly services or adolescent-friendly services have been mapped out, and people can easily just go to those places and they will be given services that they need without getting any form of stigma or discrimination. And then, for example, in Kenya, we've seen apps being developed where contraceptives are being delivered to people in their own homes. And when we have such an aspect or an approach to contraception, we are making an environment where young people can access contraception in a private and secure environment, because a lot of them fear going to this to service providers to access services or to get these contraceptives. So when you have apps that are able to combine not only information but also service delivery, it becomes very, very important in terms of creating an environment where young people feel that they can have these services. However, it's not all rosy, because challenges have come up. And as it has been said, using technology is just not about, using technology requires a combined effort between health and information and technology. So if you come from a region where, yes, the health department or the health ministry is willing to invest in programs or initiatives that want to avail this information, but then you have information and technology lacking in terms of capacity to make sure internet connectivity is actually sufficient in a region, there's going to be that disconnect, such that, yes, one area is willing, but the other does not have the capacity. And that also goes back to, we need some of these government institutions to understand that they cannot operate in isolation. There has to be a coordinated approach when it comes to addressing health issues, especially when we are moving towards telehealth. How do we move to a sphere of operation where resourcing is not just linear? Resourcing takes into consideration that at some point, we may have to work together with a particular ministry. So for me, that has been a learning experience, not only as an individual, but also as the chair of the Youth Coalition. For me now, as being in that position of doing youth advocacy, when we find ourselves in spaces where we are advocating for the realizations of this right, we find ourselves meeting people who do not see the value of our work. We are facing a lot of opposition. We are targeted. We are also painted to look in such a way that we want to sexualize children. And for us, that has, at some point, it has created security risk for some of our members. And we wonder, when we want to provide information that will empower young people to be able to navigate spaces where they are constantly at risk, but we are being painted to look like we are here to sexualize children, as opposed to empowering them, becomes very, very problematic. So there are efforts being made, but the challenges, especially for young advocates, are a lot. And for young advocates, being in this space is more challenging because most of us are doing this work as volunteers. Most of us are doing this work as side things that we're doing, because either because of our age, we are still in school, or we're just getting into the job market. So meeting young people, and young people just getting to a point and saying, we cannot, it's becoming untenable to continue being SRHR advocates, because how do I stand and fight for something on a volunteer basis and my life is at risk? So for us, that would be, can we start by having honest conversations? Can we create safe spaces for young people to actually talk about these issues? Otherwise, yes, we will continue talking about universal access, especially when it comes to young people. But as long as young people do not feel safe in these spaces, that they're trying to raise these concerns, and even when they develop these apps in certain countries, it's illegal, your life is basically at risk. It's something that may not be sustainable for a long time. Lastly, the other challenge we are seeing is issues around language barrier. Language barrier is a big problem. It's a big problem because the cost of translation of some of this information is a bit too high. So especially within regions like, let's say, the regions that speak Arabic, there's very little that we know about what goes on in the Arab world. Because one, other than the fact that SRHR is not heavily discussed, getting information on SRHR into that region and also out of it is problematic. So we may have to look at how safely do we ensure young people within those regions are able to access information through apps. And these apps are also designed in such a way that do not place their security at risk.
Oh, thank you, Kerigo. And you've led us into the discussion about telehealth. And I know in many parts of the world, there has been a delay, right, in terms of innovation around telehealth because of the policies that govern professionals, like doctors and nurses. And we've seen how in COVID-19, some of those policies were relaxed, in places like South Africa, where we could actually properly implement telehealth and video calling and consulting with existing patients. But what's also important, what you're talking about, is this digital health and what access means. And I think what I'm getting is that the same prejudices that lead to a lack of access from physical structures are the same that play out on the digital sphere. And I think the digital gender gap is still a big issue, because I find even in communities where there is internet, but the gadget will go to the boy child and not the girl child, right? And so the issues again of digital rights are important, because how are people using the information that young people are inputting into these apps, especially when the legislation and the legal framework is not affirming of their full sexual and reproductive rights. So I think it's very important conversations that we are starting to have about digital health, and it is definitely the future, but the future is now as young people are innovating. But to what extent are they supported and able to do this work safely, having their own rights protected? Vithika, I know you had an extensive network in India where you were speaking to many young people, and you've been presenting globally on some of the important contributions in using digital media and communications. Can you give us the current landscape, and how do you see the future of digital health, particularly for adolescent and young women's sexual and reproductive health, when they need to access contraception and family planning?
Sure, Dr. T. I think when obviously COVID-19 hit, for most part, everybody was left confused, and I saw this sort of expression that everybody in the SRHR and family planning landscape had, that, oh, Love Matters would have figured things out because they're digital. And lots of those, conversations happening. Well, it was some of these conversations I felt were, quite uneasy, because the donor environment was, sort of pushing a lot of organizations to just think digital. Not realizing what it means to go digital. It's a whole process. What does it mean to take operations digital? Every organization is unique, and just to say that digital is an answer to everything, was not really the answer. Even at Love Matters, we use a very unique combination of digital and how we take digital in some of the most hard to reach areas. Like, what are these different tools that are available? So I think I think everybody realized the importance of telemedicine. Just jumping into that option, we really have to do a groundwork to really understand what will make telemedicine successful. Does it mean that any doctor or service provider who is using telemedicine is actually youth friendly? Do they even have the digital training to be able to use that? Do frontline workers have the the training as well as the devices they would need perhaps to be able to use and guide people towards telemedicine? What does it really mean? And you spoke about gender divide when it comes to digital gadgets at home. And clearly, we work in communities where, for most part, if a woman chooses to go for a certain contraception, or even chooses to marry someone or take any decision, the blame is actually on the mobile phones. It's the mobile phones which are basically creating problems in the community, and girls are asking for too much freedom. And it's a very interesting experience we had. We worked with young people. We were really trying to see what are their aspirations as well, and how to make sure that at this point of time, when we're looking at schools and colleges closed, they're really struggling mentally, emotionally, physically. How do we make that connect with them, and how can we possibly build their capacity and a certain skill which is aspirational? And they came up with for most part, most young people were aspiring towards being content creators. They really want to be digital content creators. There is this aspiration to have a mobile phone, because that seems to be the only connect with the outside world, with their friends and people they knew. They wanted to explore different platforms, wanted to make their voice heard. They felt it was such an opportunity, and everybody wanted that opportunity. And of course, it had a huge impact, because families and how they were looking at certain things. It really was a very interesting, sort of a situation in the community, how young people were really aspiring to have something and looking forward to using digital platforms for information, for services, even for providing information to others, and at the same time struggling to have any of these things. I think government, when we talk about government or foundations and organizations, everybody was aspiring to be digital, but nobody was really thinking about digital literacy. What does it really mean to go digital? What does it mean for young people to be digitally literate and to be able to use these platforms responsibly, but also understanding their own rights when it comes to confidentiality and privacy? One of the struggles we ourselves at Love Matters have had is every time, I mean, we have over 20 million young people connected with us across India, tier 2, tier 3 cities. And every time, we are, sort of offering products to reach to them directly, nobody wants to give their home address. And, everybody says, well, I know I can have this information in a discreet way, but imagine a parcel or a courier getting to my place with all of these products, contraceptive products that I need, that I want. I cannot have my family members look at that packet and say that, what have you been up to? So it's very different when we talk about even access through online portals. There is still a problem because attitudes haven't changed, right? And attitudes are not going to change overnight. We have to understand that even when we talk about online supply chains, we have to really look at the community. We have to do the groundwork. Comprehensive sexuality education has to be made available. We have to think about CSC as any other academic subject. Unless that happens, we are not going to be able to normalize things. We are not going to be able to change attitudes. We will never be able to make it conducive for young people to access information and services the way they want. And I think that's really where the groundwork has to be done.
That's amazing. Wow. And I think it is so important to remember that the need for family planning, the choices being made around contraception by young people is happening in a very policed, social, political contexts. And that for many, they may have information, but because of the contexts in which they live, that makes it unlikely that they will have an uptake into services. And I think that's another area that we need to explore. How do we meaningfully change societies? How do we meaningfully create enabling environments where anyone, anywhere, should be able to have their rights respected, and those rights obviously met with accessible services in a non-discriminatory, private, or at least stigma-free. And I'm starting to know that our time is gonna go very soon, and I'm still enjoying this conversation. But I want us to start looking forward a bit. What's working? What do we want? And we know often we can diagnose the problems really well. Let's spend a little bit of time telling people, what are we demanding as young people? What do we want for our contraception and family planning needs? What do we want in terms of policy and resourcing? How do we want to be spoken of and to? Because most of the time, it's that other issue, right? When you do go to a facility, you are not spoken to in an affirming manner. Some people don't go back because of those experiences, and that often determines how they seek health and services later on in their life. So I often think about it as a life cycle approach. If we could imagine what that could look like for ourselves and in our community, what would that be? And I will start with you, Margaret, on this one.
So really for me, and I love to talk about solutions, and the reason is because we've moved away from the era where when we see young people, we think, oh, they're just the problem. No, they are the solutions, and they have that solution. And that's why for me, to really ensure that sexual and reproductive health and rights, including family planning, stay on the agenda, it's very important that we're engaging with young people and youth-led organizations and networks. Again, when I talk about engagement, I mean meaningfully engaging. And that includes also ensuring that they have the resources to be able to implement all of this beautiful, innovative ideas that they have. And we really need to remove the bottlenecks, and also they need to be part of the conversation. I know we've made a lot of progress over time. I have to acknowledge that and say thank you to the Federal Ministry of Health in Nigeria and the government of Nigeria. We recently launched the policy on adolescent health and development. And I can tell you that young people were meaningfully consulted and engaged in developing the policy. But again, we know that it's not enough to have a good policy, that it's very clear. Again, the one thing we needed to do was to stop making policies ambiguous and left for providers to decide what it should be, or people just begin to read into it and they just pull out what is comfortable for them to do. So again, this document is great, but we know that implementation, especially at subnational level, is something that is key. But the truth is, youth-led organizations are well positioned to support the government. They are already been part of technical working groups, ensuring implementation. We just need to give them all the support that they need so that they can ensure that these policies are implemented. The other part is we must really consider and continue to, I know we keep saying this, private sector. Again, during the pandemic, the one way, whether it was still they had to pay out of pocket, but we've seen from research that young people, because of confidentiality, privacy, and all of that, they'll go to the patent pharmacies and all of that. So we really need to find a very creative way of working with PPMVs. Also strengthen referrals and linkages, because for young people, it's a whole issue. It's a whole, not just issue. I mean, it's if I'm walking into a facility, I might need 3 different services at the same time. It could be contraceptive. At the same time, I maybe issue around STIs, around HIV/AIDS, a whole lot of, or even as we might think it's so same, or menstrual hygiene and care and a whole lot. So we really need to be ready to attend to young people and make the necessary referrals, strengthen it, and the linkages. The one other thing is, yes, we're doing so well. We've seen the power of digital health, that we need to maximize the new and the traditional media to provide adequate and accurate information to young people. So for traditional media, we still have young people who they're only left with radio or TV, and then we need to ensure that the messages that are going on are not just any kind of biased messages. Again, our facilities, the healthcare facilities needs to be able to provide youth-friendly health services. While it might be okay to say have youth centers, we know it comes with some stigma. It is not cost effective, because what I've also seen in Nigeria, and I think this is not just peculiar to Nigeria, is that they are usually donor-driven projects, and just after the project lifespan, it's been turned into a football pitch or a viewing center or whatsoever. But the government needs to own up to this responsibility and ensure that every primary health care center, it's provide youth-friendly health services. It's simple to do. The providers must be youth-friendly. For me, when I look at a facility, the only way I can tell that it's youth-friendly is that young people are able to go conveniently and also access the services. They're happy with the services. They're also happy to go back again so it means that these facilities can retain young people, and young people are excited because they have the wide range of services that they can get from the services. I think it's time. Yes, we have some policies that also say integrating youth-friendly health services into PHCs, primary health care centers, but we need to talk it. We need to walk the talk. We need to implement it, and young people can conveniently access services.
Thank you, Margaret. I love that. Conveniently access services, and they must be retained. And that's the standard we need to keep. Yeah, I really think that's a great. And Vithika, for you, in your area of work and expertise, what are the things we can look forward to, the positive things that we can also support you with, I suppose?
I mean, I think the most important thing is to test our assumptions and talk to young people, nothing about them without them. I think that's really, really, really important. And when we say that, we also have to understand that young people are not a homogeneous group. And for us to be able to understand that we cannot leave anyone behind, we have to understand, the vulnerabilities. We have to think about everyone, and we have to really take all the young people along with us. So really talk to them, know from them, I think what needs to change is what I spoke about. How can we have comprehensive sexuality education included as an important part of everyone's lives, for all adolescents, for all young people, and make sure that everyone around the globe has access to information, services, and the freedom and ability to be able to take informed decisions about contraception, about choices that are out there, and decide whether they want to have children, how many children, whether they do not want to have children, and just lead healthy lives and participate as equals in the society.
Thank you, Vithika. And Kerigo, for you, I know you're an amazing researcher as well. So what are the things to look forward to, the positives, as we wrap up this conversation?
Thank you. For me, the first step would be, can we as a society understand and respect what it is, what the evolving capacity of the child means, right? Because that is where the main problem stems from. The fact that a lot of us do not understand that as children grow up, they become more and more equipped to understand information. And because of that, we must also understand that young people, especially adolescents, and are sexual beings. And because they're sexual beings, they cannot be passive agents in their lives. They have to be active participants in every aspect of their life. And that includes engaging in conversations around decision-making that pertains to their sexuality and the sex. And that involves conversations around, as Vithika has said, how to develop an appropriate comprehensive sexuality education framework. How do we go about ensuring that they are developing youth-friendly or adolescent-friendly SRHR services? So we need to sit down, have honest conversations with decision makers, in this instance being adults, and understand that there comes a point in time where overprotection is actually disempowering. So can we have honest conversations? Thank you.
Thank you so much for that, Kerigo. And I want to say thank you to our panelists for this amazing, amazing conversation. Thank you for joining me virtually to take the pulse on family planning. And I can say without a doubt, we are in safe hands. The future is secure. We obviously have to keep paying attention to all of the ways and different methods that people use to hold us back. But I know, and I speak for many of the people who've watched this today, I'm inspired. I'm completely blown away by the work that you are all doing in the different spheres of life and of the sector. And on this World Contraception Day, I want to remind us all to take this opportunity to reflect for ourselves the types of world and the types of healthcare facilities we need to be able to support us as we grow health and well, as humans who are worthy of wellness and all of the good things. I think it's important, of course, to also look at the impact of COVID-19, but also start to imagine a future, right? Because even before COVID-19, many people, many health systems around the world were already living under the fragility of ailing health systems. And in order to look forward, in order to leave no one behind, we have to have meaningful involvement and decision-making by young people, by the youth, I think at all levels of governance. And we have to have universal access to reproductive health care, and family planning, contraception services must be integrated into existing national health plans as well as the national health coverage. And regardless of who you are in the world, where you are located, your socioeconomic status, your gender identity, you should be able to access stigma-free services that are confidential, in private, and that you are being given a range of modern contraception methods to support your decisions. Now, that was a fantastic, fantastic panel discussion. And thank you once again to our panelists for not just gracing us with their time, but also giving us such powerful insights about the different work that they do. Now we will move over to the live Q&A session with our panelists still. If you would like to participate, please place your comments or your questions for the panelists in the Q&A function in your Zoom, and we will engage with these. You may also track us on our Twitter, Instagram, and Facebook and engage further with our feed and use the hashtag #PowerOfFP. That's hashtag #PowerOfFP. Wow, panelists, again, a heartfelt thank you. And also thank you to the people who joined us for this conversation. I think it is so encouraging for me to have noted from all of the different places in the world that all of the people joined us from. And I think equally the way that you have learned and been inspired from the panelists, we too take courage from all of the comments that you have put in the chat box, and we note some suggestions. And some people, for example, Kurti has put in some resources from UNFPA. And as we go into this dialogue with the panelists, I would like to just remind you of a few things. We do have French interpretation for this call. So if you can speak slowly so that our interpreters are able to keep up and offer the French translation. Again, just as a reminder, there is a language function for interpretation on the Zoom taskbar. You are also encouraged to put your questions in the Q&A function, and many of you have, and I have noted those, and I will be putting them forward to the panelists. But also, if you would like to raise your hand and ask your question to the panelists, you can, ask either just a general question or either a particular panelist you would like to direct your question. Our host on Zoom will unmute you to give you an opportunity to ask your question live. And again, we are champions of family planning, and I see this work as us being defenders of human rights. And in that spirit, we are launching our new campaign that's called The Power of Family Planning. And we encourage you to share this link and also share your own story on the power of family planning. And the website is icfp2020.org/voices. And this is where your story will appear on the family planning story wall. And the ICFP2022.org page is really a community page. We direct the content, we direct the dialogue, and I will really ask all of you, after having listened to today's panelists, to really share with us what has been the power of family planning for you. And this may be a personal story, or maybe a story of how your work has had impact in this area of family planning. And I'm going to ask the panelists, because I already collated some of the questions from the Q&A section and some of the comments. And just to start, someone says that I believe you all work for local organizations, some of which are tied to regional and global organizations. How do we improve relationships between these levels to make long-lasting change? And what role does trust and equitable collaboration play? And I'm going to ask you, Margaret, first on this one, because I know not only do you work in Nigeria in one city, but you spend most of your time traveling to many sites. So how do you see the regional, national, global organizations working together? And what role does trust and equitable collaboration play? Thanks, Margaret.
Thank you so much. It's been a wonderful conversation. And I think the one thing, soon as I saw the question, the one thing that pops up for me is shared vision. We're stronger together if we all share the same vision. So really, what exactly do we want? How do we want to see that young person? So if we're able to all come together and identify a shared vision, it's easier for us to work together. I know that we're contributing in one way or the other. Also, the regional platforms, the networks are meant to bring us all together because there is power in numbers, no doubt. And if we all come together in unity, and I think that that binding force is the shared vision, and not vision shared. Shared vision because we all have to own the vision. We come up with it together, and we're saying the reason we're doing that is that every young person deserves, has the right, and should access sexual and reproductive health and rights. If we all agree to it, it means that we own it and we can work towards it. That way, it's easier for us to say, oh, this is the issue. This is how best we can come. And of course, it's not in the number of meetings. meetings are important because, again, that is where we develop the shared vision and do a whole lot. But if we keep working with that shared vision, you are sure that everyone has that understanding of what we really want to achieve. That way we're reducing competition. I mean, unhealthy competition. And we're able to forge ahead together. So for me, honestly, it's just the shared vision. It's good that we create a lot of platform. Thankfully, with the virtual platform, we can always come together, talk about the issues. I'm happy learning from different countries what we're doing and see where are the gaps in Nigeria? How can I leverage on linking mental health with sexual and reproductive health? How can I, so we keep creating such platforms. But again, the point is we need to all together have a shared vision that really help us get to where we want to be.
Thank you, Margaret. And there's another one here, and I think it will actually fit in well with Vithika's point that she was making earlier on about comprehensive sexuality education. And of course, knowing that you work with Love Matters India, you also have a lot of reach with young people and have been quite innovative in the years even before COVID. I'm sure you've had to be even more innovative at this time. And someone made a comment that the pandemic has stressed and highlighted the profound impact that lack of access to positive, comprehensive sexuality education has had on young people, and the lack of articulation of needs and lack of acceptance of young people's sexual needs. So moving ahead, the person is saying we should continue promoting sex positive narratives, education, and SRHR services. And they're saying that it would be interesting to know about successful efforts having in promoting comprehensive positive integration of SRHR. And I think this one is great for you, Vithika, as someone who's had done this work for a while now.
I think when we're talking about COVID, how organizations have been, I would say, have been innovating in the digital spaces to really look at what can be done to make sexuality education accessible to young people, but also through formats that work with young people. There is a whole body of work. Also with the fact that why are we looking at digital platforms, right? One of the primary reasons, let's say when we're talking about India or where Love Matters is operational in different parts of the world, for most part, comprehensive sexuality education is not existent, right? It is not accepted, it's not there. And at the same time, there is enough evidence to prove the unmet need for information by young people, by adolescents. And why do we need this? Then looking at a variety of approaches that can help make it even much easier for young people to be able to access information through formats which are simpler, which are conversational, and which of course are private and confidential. I think that's really the foundation of how Love Matters was born 10 years back, really knowing from young people. And they said, well, we need information through mobile phones. And I do not want to be judged for the information that I'm seeking. So it talked about the stigma, it talked about the shame and fear, and at the same time, the choice of a medium through which they would want information. So in context of this work, and I think even during COVID, it is very important to understand that the medium is also the message. The mediums that we are using to connect to young people for information are also an important message that we are giving. I think there are a whole variety of approaches. One thing is to just jump into digital spaces. I would always suggest that any digital space that is created in any part of the world has to be co-created with young people, right? It can never be a blanket solution for all kinds of young people. You can have a digital solution, but it'll have to reach out to different parts of young people in different ways. Also test your assumptions, ask questions. Is it truly inclusive? Is it intersectional? Is it reaching out to everyone? Perhaps it is not. And there is still beauty in saying that, well, it works for a certain set of people and we might have to tweak the approach digitally or otherwise to actually get to the other group. So I think there is a variety of work that is happening. What I thought was really interesting during COVID was how in different ways and means, actually saw a lot of young people becoming advocates of sex-positive information using social media channels. This was non-existent. This was really non-existent 10 years back. And I would say in last 2 or 3 years, just look at the number of young people who are owning social media pages and talking about sex-positive information. In fact, actually, the influences for other young people. So it's about peer support, how they're speaking openly, and how a lot of people in hard to reach areas, like I said, are aspirational content creators. We have just run a program where we actually trained and built the capacity of young people in the most remote areas to use their mobile phones and create content around SRHR issues. It's the power that they have to advocate for their issues and in their lives. And I think that's really important, for them to be able to actually create content and have their own channel, use social media platforms, the different platforms which they aspire to be on, and then be able to advocate about these issues. I think Love Matters, at Love Matters, we looked at one of the big challenges in terms of how do we make information accessible in a way which also looks at digital challenges. And we have, worked on India's first augmented reality app on CSC, which will not require internet. And it works with the biology book, and the triggers information and how it comes out. And the idea really is to keep innovating and keep thinking, how can we use different mediums which are available to be able to amplify CSC to a large majority of the audience, and at the same time keep advocating, not only with the governments, not only with the parents and educators, but also with online platforms who are operating more so as online gatekeepers currently. So I think there's a lot of work which is out there, which is happening on CSC. A lot of backlash when we talk about online censorship as well, which talks about the problem. But I think we have made some good progress.
Thank you so much for that, Vithika. And you said something very important about if the solutions are really leaving no one behind, and that we need to have a certain honesty about where they reach, and so that we can then make a plan and review and come up with strategies of how to ensure that we include everyone. And I'm coming to you, Kerigo, now, because Deborah from Rwanda is actually speaking about something and expanding on what Vithika was saying. And Deborah is saying, could any of the panelists speak on what disenfranchised groups, example, people with disabilities, LGBTQ+, are dealing with challenges particular to them in their own countries or region? And I think this is best asked to Kerigo.
Thank you for that question. For us in the Youth Coalition, we have seen that persons of diverse sexuality and gender identity, including, sorry, let me just take that again. For us in the Youth Coalition, what has become very, very evident is that persons from disenfranchised populations are experiencing a disproportionate amount of discrimination, and this ultimately impacts how they experience issues around access to sexual and reproductive health services. Because we must remember that a lot of sexual and reproductive health rights issues have been criminalized in a lot of countries, not only in Africa, but across the world. So when we have conversations with young people and persons of disability around issues of SRHR, what we do is we aim to create safe spaces. In these safe spaces, members of this community are the ones who lead the conversation, because we want to hear from them. Because quite often we speak for them, which is not right, because a lot of assumptions are that they cannot speak for them. And that is why this whole terminology, voice of the voiceless, is very, very contentious and problematic, because members of these groups are saying, no, we can speak for ourselves. We understand our problems. However, when we have these conversations, what we are also seeing is that security concerns are coming up. How do we ensure safe spaces for members of the LGBT community when they are engaging with us? Because for some of them, it is basically putting their life in danger. So when we have these spaces, when we convene these spaces, we have to sit down as the conveners of these forums to set aside emergency plans in case we need to ensure the safety of members of this group. How do we go about it? So as we design programs, we need to understand it is not a one-size-fits-all approach that can work. There are certain communities, there are certain groups that are disproportionately affected, and the situation is significantly very, very different. So in as much as we would like to say that let's adopt a particular narrative or a particular approach, we must also consider what does this mean for person A in a particular country, and even within regions, right? There are certain countries that are far much ahead when it comes to rights of persons of the LGBT community. So a particular approach can work there, but it cannot work in country B. So I encourage everybody that when we are talking about access to family planning and access to SRHR in general, we must be cognizant that there are certain populations that are going to experience these things differently. The other thing that has come up, and I think we really need to have a conversation on, is issues around access to abortion, especially for the transgender population, because they are discriminated upon when they go, when transgender men go seeking abortion services. So we need to open this conversation by first and foremost starting conversations around decriminalization, because I think most of our challenges come from the policies that we have and the kind of environment that these policies create. Because when it is hostile, it becomes practically incapable to have these conversations. And if, for example, adults are unable to have these conversations, imagine how difficult it is for young people within these populations to speak up. Thank you.
Thanks, Kerigo. And you've touched on very important discussions. And I think on this very important day where we are celebrating World Contraception Day, even though it's still a few days ahead, I think what's important is that it has provided us an opportunity to talk about universal access to contraception and family planning services in ways that perhaps waiting for an in-person meeting, right, couldn't have assisted us. And so I really think the fact that we have so many people also on this call, you know, sharing their ideas and links to resources, that's what community is. And I'm getting that as much as we may be all tired and a bit exhausted or going through whatever it is that we are going through personally, as a community, we are that much more stronger. We are much more clearer about where we are going. And I think, you know, what Margaret said earlier was very, very important about a shared vision and not a vision shared. And I think this call has really achieved that for me. I feel like we were able to really get into the details. There are two questions from audience members, and I know that our Zoom host will assist in making sure that if there are any hands, the people are unmuted so they can ask their question. Just to note that we are getting to the tail end of our conversation. So the questions and the answers will need to be short. While we are waiting for that to happen, I can take another quick question. One important question that's important to me is about how do we avoid interruption of contraception? Because when all is said and done, people have information, they know their rights, but they still can't get access. I think personally, we should have more stronger regional capacity to produce medicines and generic medicines. And we've seen it even with the COVID-19 pandemic and how the lack of intellectual property to be able to produce, right, vaccines is meaning that people in other parts of the world are left behind. So what would you say, Margaret, would be a way of ensuring that we do not have interruptions in contraception?
Thank you so much, Dr. T, for the question. So again, I know that it's difficult getting some commodities at some time, but again, when we're training health workers, it's very important that we include the aspect of record keeping, because if most times we think that, oh, we can just wait until there is stock out and then ask for more commodities. Meanwhile, we're supposed to have done that. There are systems that are already in place. They are supposed to help get those commodities in good time. But if the reporting system is weak, then it makes it difficult for the commodities to also get there on time. Of course, there are a lot of bottlenecks, even in transporting this commodities to the last mile, and all of those are what we expect that the government and every partner should be working in removing this kind of barriers to it. But again, the one very important thing that we need to do is to ensure that we look up at opening up the services in different places. And again, assessing where I think it was Vithika or Kerigo that talked about getting the services to them where they are. It's very, very key. So most times in the storehouse, you have all of this. In fact, some even expire. But because we're not putting so much pressure on last mile distribution, then it becomes a problem. So for me, I would say that it's important that while we're creating demand, we're also meeting the supply. And the two ways we can do that is to ensure that proper record keeping, and people are requesting. So service providers, M&E, monitoring and evaluation officers, those who need to do what they need to do on time so that they're requesting for the commodities even before the shortage. There's also forecast. So you can look at the trend. And again, maybe we've not talked about data. We can overemphasize the importance of data. Data tells you how much, what's the trend, even in the method mix. Of course, people are open to, you provide balanced counseling and they can choose from a wide range of contraceptive, but there are certain trends that data would show, which we need to leverage on and ensure that people are getting what they need, and which is what they deserve exactly. So I would say invest more in data, but useful data for decision-making, data use, and then making sure that all the bottlenecks in transporting it to the last mile are being removed.
Thank you so much, Margaret. And we have an audience member who has been unmuted. Please go ahead and ask your question now. The audience member whose mic has been muted, please go ahead. We may be having a bit of a technical delay with the person, but I think what I can say for sure is that from monitoring the Q&A chat box, as well as your comments and links to the resources, I just want to say thank you so much to all of you for remaining on this call and for remaining so engaged. This has been really an amazing virtual session. And I want to thank my panelists, Vithika, Margaret, and Kerigo, for making the time to share your knowledge and your experience with us. This conversation also helps tie to the broader conversation of the International Conference on Family Planning 2022 and the theme of universal health coverage and family planning. But before we go, I have one more quick ask of you. We want this conversation to keep going, and you can help us by participating in ICFP's Power of Family Planning Community Action. We are interested in hearing why family planning and contraception is so powerful in your life. And we will continue to engage with you on our social media and track the interactions on Twitter, Instagram, as well as our Facebook feeds for your engagement, as well as any comments or questions that you have. Please use the hashtag #PowerOfFP. Hashtag #PowerOfFP. With that, I would like to say good morning, good afternoon, or good evening from wherever you are in the world. My name is Dr. Tlaleng Mofokeng, and it was wonderful to be your host. Goodbye.